Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health? Just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 31 of the Ask Dr. Angela podcast. I have to tell you, people, you are so good. And the reason that I'm saying that you are so good is because in episode 30, one of you lovely, lovely, lovely ladies and followers asked me about dense breast tissue. Well, boom. Guess what we're talking about today? So this is kind of how it goes. Here's the setup. I was seeing patients last week, minding my own business, multitasking. I'm like the queen of multitasking. I always have like 1,000,005 things going on at once. I'm seeing patients. I've got my MacBook Air open, jotting down thoughts for the podcast, blog post ideas, answering emails, doing my social media thing, answering and returning phone calls, and then boom, all of a sudden, across my email screen, I see that the ACS, that means the American Cancer Society, has released new guidelines for mammography. And so I saw this, it immediately caught my attention. It was almost like, a message from God. Oh my gosh, the American Cancer Society just changed the mammogram screening guidelines. And the reason that this is so interesting is because in episode 30, we talked about breast tissue and dense breast tissue. And I think I probably also mentioned, self-breast exams, awareness, when to initiate mammography. And then boom, the American Cancer Society just totally comes out of the sky with these new guidelines. So let's talk about the major changes, or let's just say modifications that they've made to the screening guidelines, okay? So here we go. The first huge change is the recommendation for screening mammography to begin at the age of 45 instead of 40. So you did hear me correctly. They are recommending that women start getting mammograms at 45 instead of 40. Number two, they're recommending annual screening mammography between the ages of 45 and 54 and biannually thereafter. Now that's different for a couple of reasons, because now once you hit 40, number one, you start screening mammography, and typically it's annually. So that's another difference. Number three, they recommend continuing with mammography as long as the person that's getting it is in good health and has a life expectancy for at least 10 years. Okay. And then now this is the biggie. The fourth huge change in the recommendations are no further clinical breast examinations, regardless of the age. And so I read these and I was like, wow. I'm going to say that again. I was like, wow, really? So this is the deal? Okay. So I have a couple of thoughts with regards to this. Number one, I do get it. I understand where these guidelines are coming from, specifically with the overdiagnosis, the over-testing, the false positives, all of the headache with the additional screening, all of the headache with the additional biopsies that in all actuality, most of the time come back as normal and hence were not warranted in the first place. I totally get it, but it's going to be really interesting seeing how clinicians are with regards to implementing these guidelines into their clinical practice. Because number one, if you just look at the latest pap smear recommendations and screening guidelines, who really does that? I mean, my patients don't want a pap smear every 3 years or every 5 years, in spite of the fact that if anybody is educating folks, it's me. I'm all about the guidelines. I'm all about the education. I'm all about the self-empowerment and allowing folks to make an informed decision. But I've still got 70-year-olds that don't even have a uterus that are still insisting on getting their pap smear. So I'm really interested to see how well these guidelines are going to be received because, number one, we all have friends, family, or know someone who knows someone that has a girlfriend that was diagnosed with breast cancer like in her 30s, in her 20s, or before, screening guidelines are even recommended. So, I'm really anxious to see how this is going to be received across the board. One of the things that I stand by and will continue to stand by is the recommendation for breast awareness. And this past guideline prompted me to do a whole blog post on the new guidelines, breast awareness, et cetera. And again, breast awareness is you knowing what your breasts look and feel like. Just baseline, you knowing what your breasts look and feel like. And certainly if you recognize a change from that baseline, what you know to be your baseline, you have got to tell your physician. The other thing that I was waiting for after I read these guidelines is I was like, this is the American Cancer Society. They don't dictate the way that I practice. I'm an OBGYN board certified. So I don't know, how can we say this? The body that governs how I practice is the American College of OBGYN. And so after I posted last week's blog post about this, I said, I can't wait to see what ACOG has to say about this. And then boom, the next morning, they released a statement. They're like, well, we heard what the American Cancer Society has recommended, but we are standing by our guidelines, which is screening mammography starting at the age of 40 and annually thereafter. And they are also encouraging clinical breast examinations regardless of age. And that, people, is what I am standing by at this point. So remember, it's all about breast awareness. It is all about, basically just making an informed decision. I try not to practice paternalistic medicine. I give you the facts and you make a decision. As long as you are aware of the increased risk of overreading mammograms and the possible need of extra imaging that a lot of times will not even be necessary, or the possibility of having to go for biopsies based on imaging that is not accurate, be my guest. But I'm not going to tell people that they can't get a mammogram if they don't want a mammogram. And certainly I'm happy to hear that the American Cancer Society also is not saying that either. They did say that if people still want to get annual mammography or start at the age of 40, so be it. So this is good because this is an opportunity for you to challenge your clinician to just, review your general health overall, look at the risk factors that pertain to you, and just kind of to evaluate your personal values, preferences with regards to screening mammography. It certainly is always very important to make sure that you are aware of the pros and cons. And just remember, this is about you. This is about your health care. And only you can decide what is going to be in your best interest. So I'm challenging you to challenge your physician to make sure that you have all the facts so that you can make the most informed decision possible. That was kind of a lot, but I was just kind of fired up about that. I'm so passionate about these kinds of issues. So if any of you have any thoughts that you'd like to share about this, I would love to hear from you. I know that I got a lot of feedback and questions on social media about these screening guidelines and kind of where I stood with regards to them. I would like to personally thank you for taking time out of what I know is a very busy day for most of you and listening to the Ask Dr. Angela podcast. If you have some thoughts, if you have a question that you would like featured on the podcast, please go to www.askdrangela, that's AskDrangela.com. Click on the microphone and do what you do. If we decide to feature your question on the podcast, we will send you one of our bomb-ass t-shirts. And since we're transitioning into fall, we have gotten rid of the tanks and have gone with a very soft V-neck t-shirt, which is pretty bomb. It's pretty bomb. In closing, I'd like to leave you with a thought from Walter Anderson. Walter said, "Our lives improve only when we take chances. And the first and most difficult risk we can take is to be honest with ourselves." Until next time, look better, feel better, be better. Looking forward to reconnecting on episode 32 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.